Hey guys, this is Dr. Samir Islam. I want to thank you guys for joining me today on my Facebook Live. And today we're going to talk about the last in our series of hemorrhoid issues. And the topic is how to take care of your hemorrhoids and how do we treat them and what can we do to fix up these issues that you may be having. And so today I'm hoping to give you some information on what you can do to take care of your hemorrhoids at home and what options we can offer for you to get rid of your hemorrhoids so they don't cause you any more problems in the future. You don't have to worry about these issues again. So as a summary, let's review what hemorrhoids are. So keep in mind, hemorrhoids are swollen or dilated veins within the rectum. In some cases you can feel or see the hemorrhoids. In other cases you can't because they're hidden from you. But even though they're hidden, you still may notice the symptoms from those hemorrhoids. There are two main types. We have internal hemorrhoids, which are hemorrhoids that are inside the rectum, which you're unable to see. But in a lot of patients, this is actually the reason why people have a lot of their symptoms. Then you have external hemorrhoids, which are hemorrhoids that you can see and they're outside the rectum. And more often than not, these external hemorrhoids are mainly cosmetic, so meaning that they don't typically cause issues, but they don't look good. But the main symptoms a lot of people have are ones from internal hemorrhoids. So what are the risk factors for developing hemorrhoids? So constipation, either having few bowel movements per week or straining or pushing more often than not, pregnancy and lifting heavy objects, and sitting down for long periods of time. These are most common risk factors to develop hemorrhoids. So ways to help minimize you from developing hemorrhoids is to not have these risk factors. So making sure you're not constipated, making sure you don't lift heavy objects on your own, making sure you don't sit down for long periods of time. So the symptoms from hemorrhoids can be a wide variety of things that you may be suffering. So it include things like rectal pain, bleeding, itching or pressure in the bottom. You have actually tissue bulging from your bottom. You have leakage of feces, or even difficulty cleaning yourself after having a bowel movement. These are very common symptoms that people have when they have hemorrhoid issues. So what can we do to help treat the hemorrhoids? So things that you can do: number one, obviously avoid constipation and avoid straining or pushing. And this is a lot easier said than done, but one of the more effective ways to help out with that is to take fiber. We typically recommend 25 to 35 grams per day. These include things that you can take in food, such as bran or things like that, or even fiber you can get over the counter, whether it's things like Metamucil, Citrusel, Benefiber, gummy bears. These are very effective ways to help keep your bowels smooth and prevent you from getting constipated, which in turn should help out from you developing hemorrhoids. And there are some people who need laxatives, which is perfectly fine to take. Laxatives are very safe medications and they're very effective. And you can use laxatives for a long time as long as you have permission from your healthcare provider. Don't be afraid to use laxatives. Don't be afraid to use this for periods to help you out with your constipation. It's not a problem. Now, having a warm sitz bath is a very effective option when you have hemorrhoid problems. And what this basically is that you want to fill up the bath water with just warm water, not a whole bunch. You want to soak the rectal area for 10 to 15 minutes, 2 or 3 times per day, and adding that sitz baths in there. You don't want to add soap, don't want to add any bubble bath, you don't want to add any other additives to the bath water. And what the sitz bath does, it actually helps to improve blood flow to the rectum and, more importantly, relax the muscles in that area to allow the hemorrhoids to heal up on their own. It's a very effective treatment that you can have on your own to help out with the hemorrhoid issues that you may be having. Then also there are topical creams that you can get over the counter. Things like Preparation H or Witch Hazel. They're very effective creams to help out with hemorrhoids. So doing all these things, avoiding constipation, warm sitz baths, or topical creams are very effective options for hemorrhoid issues that you can do right now. But this is not a permanent solution for hemorrhoids. More often than not, patients will have recurrence of their symptoms and they'll have to do these things more often and more often. So because of that, we have other more effective and long-term options that we have for hemorrhoid issues. So one of the things that you may have heard about is the hemorrhoid surgery, and this has gotten a pretty bad rap for a lot of good reasons. So what hemorrhoid surgery does, they actually cut out the hemorrhoids surgically. It's done both for internal and external hemorrhoids. I will not lie to you, it is a very painful procedure, but it's effective. And you may have heard the horror stories from hemorrhoid surgery, and those stories are true. Unfortunately, things have not changed with respect to hemorrhoid surgery. It can be a traumatic and a painful experience. So because of that, we have developed a more effective option that is painless, non-surgical for hemorrhoid treatment. That's called hemorrhoid banding. This is actually an outpatient procedure done in the office. It takes about 10 or 15 seconds to do. It takes care of internal hemorrhoids only, which are the main causes for a lot of symptoms you may be having, including pain, pressure, or the feeling of not being clean in your bottom. It's 80% successful, so it's a very effective option that we have for hemorrhoids. And what it does is that you actually place a rubber band around the hemorrhoids to restrict the blood supply, so those hemorrhoids will eventually fall off. The most important thing about hemorrhoid banding is that it's painless, it's fast, takes 10 seconds, there's no surgery, it's all outpatient. You come into the office, we place that small little rubber band, you go home the same day, and you can do normal activities. It's a very effective, non-surgical, long-term treatment for hemorrhoids. And so if you're having hemorrhoid issues, I would encourage you to try to do some of the more conservative management to help out with those hemorrhoids, whether it's avoiding constipation, taking a warm sitz bath, or things like that. However, if you want a permanent treatment for your hemorrhoids that is not painful, that is not surgery, I would encourage you to come visit me to see what I can do to help out with those hemorrhoids. We offer hemorrhoid banding. It's a very effective option for some of these issues that you may have. And I'll put a link at the end of this Facebook Live for how you can make an appointment to come see me to get rid of your hemorrhoids permanently. I want to thank you guys for watching this video. If you like these YouTube videos, I encourage you to like my YouTube page, give me a thumbs up, and I would encourage you to subscribe to my page as well. Thanks and take care.